Welcome to the community classroom. This is our first class hosted by Kim Kelsey. She is a family therapist and social work educator here in Eliot, Maine. She recently spent 2 years providing end-of-life care as a medical social worker with York Hospital Hospice. She serves on the board of directors for Pine Tree Institute, a local nonprofit agency which is undertaking a major initiative focused on community-based resilience and trauma-informed care. She and her husband Shamir live in Eliot and love spending time with their growing family. And today she'll be talking about ACEs, which stands for Adverse Childhood Experiences, and their effect on individuals and communities. Thanks, Kim.
You and welcome everybody. I'm excited about this. Did you make me co-host, Laurel?
I will now.
Okay, or host, because I have some things to show. So welcome everybody. I'm going to start actually with a very short video. So I trained last year to be one of the master trainers for this initiative. So you'll hear more about the actual original study that came out, but then many things have come out since the study to try to help bring this message, the message of the ACE study, to communities and to individuals. So there's an organization called ACE Interface, and they're the ones that trained us to be able to present information about the ACE study and its implications to communities. So we have a pretty big initiative in the Seacoast area now through Pine Tree, and one of the other young ladies that trained made this video. So it's only a minute. I want to share that first, and then I'll go to my slides. So make sure this will, let's see. Share. Okay, it's blocking my, hold on. Pammy, do you know if it's blocking my little bar at the top to pull up the video?
What you want to do, I'll tell you where to put your arrow, to the left.
I think I got it. I got it.
Okay.
Okay. Can everybody see this? Okay, so that's a very powerful little video that one of my colleagues put together, and it introduces the main framework for understanding ACEs, which is to stop blaming people for their trauma and their behaviors that probably resulted from trauma, and ask them, instead of what's wrong with you, what happened to you? So that's one of the major reframes. So I am now going to present a slideshow on ACEs with some commentary. I can okay. Okay, trying again. All right, Pammy, help me here. My thing.
You want to pull up the same thing you pulled up before for the video?
Okay, wait, let me exit.
Yeah.
No, not replay. How do I
let's get out of that.
Escape.
Escape. Okay. Okay, there we go. Thank you.
Yeah. Between Laurel and me, we got it.
Okay. And then I want to present this.
On the right. There you go.
Okay, everybody can see that? Okay, so I'm gonna invite people to ask questions as we go along. I'm gonna stop halfway through just to give everybody an opportunity to catch up and ask any questions. But please feel free to, it's probably best to just wave your little hand, or Bill, since I don't see you, maybe you can do your little hand thing if you have questions as we go along. So ACE Interface is the nonprofit agency that's in charge of helping us do education around trauma and trauma-informed care. And they use this topic, Understand NEAR, which stands for our increasing our understanding of neuroscience, epigenetics, adverse childhood experiences, and resilience. So we'll be talking about those as we go along. This study came from these two wonderful men, and Robert Anda did the training that he was the director of the Center for Disease Control for many years. He did the training that I did for to become a master trainer in this. And he and Vince Folletti, Dr. Vince Folletti, were working separately. Robert Anda in Georgia with the CDC, and Vince Folletti was working out in San Diego. And they were really trying to understand why people didn't get better with treatment. Like Vince Folletti in particular was working with obesity. And he would have these clients and he would come in and he would give them the best medical care, and they would get better for a little bit, or they would make some progress, and then they would relapse. And he wanted to understand more clearly why people weren't really healing and getting better. He started to ask them about trauma. And the more he asked them, the more he realized there was a connection between childhood trauma and adverse health outcomes in adulthood. And then he and Robert Anda got together and they said, well, now we have to do a really big study on this. We can't just use your few clients. So they did this, the original ACE study, which had 17,000 participants. So it's one of the biggest public health studies ever. And you can see here that it confirms with scientific evidence that diversity early in life increases physical, mental, and behavioral problems later in life. That's the general outcome. We're going to learn about specifics. So they're both still around. They're both still doing some wonderful work. And thank you to them. So we're just going to look quickly at the human nervous system and explain a little bit about brain development. So we know that our nervous system connects us to ourselves, to other people, and to the world around us. And it consists of the central nervous system consists of the brain and the spinal cord that integrate all of our senses information from receptors located outside to the human body. It regulates internal body functions and manages elaborate chemical and electrical signaling. The nervous system considers sensory input into the context of each and every second, almost instantaneously, and determines our understanding of and response to the world that we live in. Cells in the nervous system are called neurons. They are stunningly effective at processing and transmitting information, and they have a central purpose in doing so, to adapt in ways that keep us alive. So that's the basic function of the nervous system. And neurobiologists who study the effects of maltreatment on the brain development can help us understand why ACEs are so powerful. So here we see what the neurons look like in different stages of development. So on the very left is at birth. And then the middle section is what have the density of neurons when children are about elementary school age. And then when they reach puberty, we see that there's a thinning of the neurons. And this is called pruning. Notice that there are fewer connections between the brain cells than there was at age 6. This is because the least experienced connections tend to withdraw at about the time of puberty. This process is called pruning. This phenomenon helps to explain why neglect or not getting the experiences that we need can have such a powerful negative impact on health and social functioning. So think of this as two pathways. Every person's life is unique, but for illustration, let's imagine two worlds, one that's mean and dangerous, and the second that's kind and generous. Traumatic experiences during development, like abuse, neglect, and chaotic relationships, generate predictable patterns of human brain architecture, behavior, and traits. Humans are only really made to be under stress for about 20 minutes at a time, long enough to prepare for either fight or flight or to hide, to run. So experience that causes stress chemicals to be continuously produced, for example, like child abuse, neglect, or even being in a war zone, have a really big impact on development. And under these circumstances, our bodies tend to be prepared for life in a very dangerous world. So stress hormones exert influences on cells, chemicals, and wiring. They sculpt the brain. This path is outlined on the top of the slide. For example, people who have had traumatic stress from conception to toddler years will likely have a higher baseline of the stress hormone like cortisol in their bodies. As a result, these folks may have a very short fuse, be self-focused, and may have a difficult time shifting gears from emotions to problem solving. But on the downslide, when the stress hormones like cortisol hang around for a long time, they are also toxic to brain cells. This toxicity makes it difficult for brain cells to develop healthy neural networks and can even cause brain cells to die. We also know it affects the immune system. That's why we call continuous stress, trauma, and episodic unpredictable stress, we call it toxic stress. So here's a quick question. What kinds of situations might be good match for a person who tends to be edgy, hypervigilant, emotionally detached, or quick to act? Does anybody want to throw in some ideas?
Well, I would have said first responders, but I think actually that's not where they should be.
Yeah, right. So
But they tend to be.
they tend to be, is true. And you're right. Like, actually, they need to be able to heal from some of their stress and trauma in order to effectively do their work. But they're definitely people whose brains are wired this way are attracted to those types of experiences. So you're right, which is probably one of the reasons why we're seeing difficulties with police officers in these events where their stress is, heightened, of course, and they react in ways that might not be effective for us as an entire society, right? Any other thoughts before I switch to the next slide? Okay, so we're going to think about adaptation versus expectation. When biology collides with social expectations, that's when we run into trouble. So if you put a person from a benevolent life experience into chaotic and turbulent environments, say like riot control, the person may struggle unless they've learned some coping skills or some specific skills. But likewise, if you take a child who's adapted to a dangerous and stressful world and may not have patience, he may not share, cooperate, or use words as their first choice. So when that child comes to school and we ask her or him to sit, share, be still, cooperate, there can be a painful disconnect for them, and that's hard on everyone. This child will have to be actively taught the skills required to succeed in this context, just as we would train a person from a benevolent path how to act in a chaotic and dangerous environment. Experience and adaptation, that there are sensitive periods which cause and effect. So think about this. A tiny baby doesn't really need to be able to write a paper or pass a math test, but they do need to breathe, eat, regulate body temperature, sleep, and connect, most importantly, connect with someone who's going to nurture and protect them. So the parts of the brain that control internal body functioning and ability to connect to a primary caregiver develop earliest in brain development. Brain regions that control complex thought processes like abstract writings, those can wait till later in childhood. And so continues a magnificent dance of experience and adaptation, generating age-appropriate capacities for feeling, thinking, and responding to the world around us. As the brain develops, there are sensitive periods for each brain region when the size and functioning abilities of those regions are most affected by experiences and are most vulnerable to toxic stress. New abilities build on the growth and development from earlier months and years, and over time, elaborate systems of specialized brain regions develop that help us to navigate our increasingly complex environment. So stress interpretations can differ. Set points are in place by early adulthood. And again, we see this little comparison of the density of the neurons at birth and then at elementary age. And for people who have experienced—
Kim, you froze.
I froze? I'm here. Am I frozen? Can you hear me?
We can hear you, but we don't see you moving.
Okay, so I'm just going to keep talking because I can see myself moving. It might come back, and hopefully it will. I'm on my Apple, which should be better. But for people who've experienced toxic stress during development, even a small amount of stress can feel small to some and can lead to an overwhelming crisis. So this is where we start thinking about, okay, how does this impact us as a community? Okay, what collective choices can we have? By paying attention to sensitive developmental periods, we can do a better job protecting children and providing the kinds of challenges and supports that may remediate earlier periods of stress. So it's not like once you've had bad experiences, you're set for life to be, impacted negatively for the rest of your life. But there does need to be understanding and intervention for people to heal and to get better. We have a collective choice. We can actively develop skills and accommodations that enable everyone to contribute to community, or we can continue our societal pattern of rejecting people when they have abnormal adaptive responses to childhood adversity. So think about this: when people are adapting in ways where their behavior is not looked at by society as functional, they are actually developing adaptive mechanisms. And we have to help them understand that what they did to survive needs to be tweaked in order for them to be more connected and involved in the community in healthy ways. So before we assume that a person's behaviors are a rebellious choice, let's think about the possibility that adversity may be at the heart of the challenges that they're facing. Okay, the ACE study. So I'm going to stop here for a moment. Can you see me now?
Yes.
Okay, I want to stop here for a moment because I'm going to go into more details about the actual study. And I thought this might be a good place just to stop and ask if anybody has any questions so far. And if not, I'll just go on, but let me give everybody a minute. Any questions so far? Okay, please stop me as we move along if you have questions. So we've been looking a little bit at the effects of toxic stress on individuals. Now we're going to switch gears and talk about the effects of toxic stress on the entire population. So we're going to be thinking about the field of epidemiology. And we know that epidemiologists are scientists who study the origins of disease, disability, productivity, and health in a population. They help us focus our efforts on issues and processes that will make the most difference for the well-being of everyone. We're going to talk about this large epidemiological study that was done in the 90s. And, we just keep referring to it now as the ACE study, the Adverse Childhood Experience Study. So when Robert Anda and Dr. Robert Anda and Dr. Vince Felitti joined forces, they decided they needed a very, very large study to understand and to help other scientists understand, because a lot of people were dismissive of them when they said, well, this is what's happening with my patients. And so, research guidelines say the bigger the study, the more effective it is in making those connections and helping people understand them. So Vince Felitti was working in San Diego, and he teamed up with Kaiser Permanente, which many of you know is, is a healthcare provider. And they invited 17,000 participants who were people who had health insurance. So these were generally middle income employed people. So as we start to look at these statistics, I think we have to ask ourselves, is if these findings were so profound with a study of mostly working class, middle class working people, how much more is it clear to us that trauma affects populations that are not as privileged? So it wasn't looking specifically at lower socioeconomics. It basically was a study of mostly middle class working adults. It didn't involve children. So it was adults doing a retrospective of their understanding of their childhood experiences. And Robert Anda said that when he first, gathered all the information, their researchers, and punched the numbers and saw how common adverse childhood experiences were, even in middle-class populations, he said he wept. He just cried. He had this idea that they were very common, but when he saw the numbers, it was overwhelming to him. So we're going to look at some of the details of the study. So here we go. So the the major takeaway of the experience, excuse me, I'm gonna take a drink, is that adverse child experiences are common. So take a look at these numbers. And the adverse childhood experience questionnaire that they developed basically asks 10 questions. And these are how the questions are broken down. And when Robert Anda was asked, well, why did you choose these? Like, why didn't you choose like maybe a child lost a parent to death early on? He said they specifically wanted to choose experiences that could be adapted and cured. Like, so we don't necessarily have control over if a child loses a parent to death, but we as a society have more control over whether parents are substance abusing. So then we can offer we can offer services to these families in order to affect the outcomes of adverse childhood experiences. So all of these are actually things that could, by society's standards and with individual services, be eradicated at some point or minimized in our culture. So when we look at these numbers, they divided these 10 questions into 3 categories: household dysfunction. So 27% of the people that they interviewed, their parents had substance abuse. Okay. And then you can see the other numbers. I don't have to go through each of them. The other category was neglect. And so they had questions specific to emotional neglect or physical neglect. And then they had questions around abuse, emotional abuse, physical abuse, sexual abuse. So you can see by looking at these numbers that the conclusion that adverse childhood experiences are common is accurate. Okay.
Kim, one question. The group of people that they were working with, these 17,000, they all had health problems. They had something in common, or they were just a cross-sectional?
So it was people who were part of the Kaiser Permanente system. So not all of them would have been presenting with health problems. But they would have been actively involved in healthcare. They would have been going to their primary care doctor, or they would have been seeking treatment for something. So that's a good question. So they were at least taking advantage of medical care through Kaiser Permanente at the time, either for checkups or problems. And we're going to see later the connection between the physical things that they might have been seeking treatment for, and then these numbers. Okay, did that answer your question?
Yeah, thank you.
Okay. Any other questions? Okay. So your ACE score is the number of ACE categories that you answered yes to on this questionnaire. So this breaks the population of this particular study down and shows how many people had each of these numbers. So, I mean, I guess you could say the good news is 1/3 of the participants in this study report no adverse childhood experiences. Okay, so 1 in 3 of the people in the study said, nope, none of those things happened to me. So that, I guess you could call that good news. I guess the bad news is that 2/3 had some, okay? 26% had at least one adverse childhood experience. 16% had 2, 10% had 3, and 16% of the people in this study had 4 or more adverse childhood experiences. So a fairly large percentage of the people in this study. Again, I think if we were looking even at a broader study that would include people who didn't have health insurance, those numbers would be shifted. So here we're going to look at a series of slides that show the direct relationship that they found, or I should say direct correlation that they found between ACE scores and health problems. So on the left, it says the percentage of people that were presenting with health problems, and then across the bottom, the number of ACEs. So when these 1/3 of the people said, oh, I didn't really I had my childhood was free of trauma and abuse. And, like I said, we're happy it's 1/3 of the people. They weren't presenting with health problems, but you can see the direct relationship that as the number of ACEs increased, the number of health outcomes, health problems increased, so that people with 4 or more ACEs had 45% of them had significant health problems, and people with 5 or more ACEs, like 55%. So the majority. Okay. And here we're going to start looking at some specific diseases. So this has to do with the number of adverse childhood experiences and the relationship to smoking, and then also to lung disease. So if we look at the first set of bars, the early smoking initiation, we can see that again, the darker bars are the higher numbers of ACEs. So like people who had started smoking early, and I don't know the exact number for the age of early smoking, but I would imagine definitely in the teen years, you can see the bars increase. And then current smoking. So most current smokers have the greater number of ACEs, the higher percentage of people that are currently smoking. And the same thing with of course, chronic obstructive pulmonary disease or lung disease. And so we might ask ourselves, so anxiety and depression can cause, excuse me, I got a little ahead of myself. Okay, ACEs can result in depression and anxiety, and nicotine, we know, it can reduce symptoms of depression and anxiety. So in a sense, these behaviors that we shake our fingers at people and say, oh, like if you just stop this, you'd be better, and blaming them, you know, these are actually attempts for them to regulate a dysregulated nervous system. So adverse childhood experiences cause a dysregulated nervous system. And many of the behaviors that people choose is their attempt to regulate their nervous system. So instead of shaming and blaming them for their habits, we have to help them get to the bottom of how much stress do they currently have. How many of these people have never talked about their adverse childhood experiences. So they've just, you know, pushed it down further and further so that they don't even understand why they have certain behaviors. And when we can help them understand that, yes, these experiences in childhood wired your nervous system to be in a state that needs regulation, and cigarettes and alcohol and other things are your attempt to regulate your nervous system. So in a sense, we would see smoking as an adaptive behavior if we're not looking at it in the name or blame situation, right? So these are interesting statistics here. These show we can begin to anticipate why ACEs are related to certain behaviors and social conditions. Okay, here we're seeing the risk of developing. Did you have a question, Pam?
No, I just was pointing out to my mother, it shows why people make poor choices.
Yeah.
In their life partner.
Right, right. And again, we want to take away the shaming and say that these behaviors are understandable in the context of their dysregulated nervous system and the adaptation, their adaptive changes they made to stay alive in childhood impact their decision-making in adulthood, okay? So when we look at levels of alcohol abuse, we can see
Hi, it's Patricia calling from Kittery Family Practice. Is this
okay,
Carol?
so we got to turn their mute there. Okay, Carol.
Hi, Carol. I wanted to let you know that the doctor did.
Carol, can you mute your screen?
Can you mute her by
about half
hitting
an
on
hour
the
ago to the
dot?
pharmacy.
Okay, thank you very much.
Kim, you might be able to
They
do
should
it.
be all set.
No,
Let us
I
know
can't.
if
I don't
there's
have-
any problems with that.
Okay, thank you very much.
Take care. Bye-bye.
Bye-bye. Okay, so, all right. So, yeah, Carol, you need to mute if you get another phone call, okay?
I couldn't see my screen.
Okay, okay. So we see, that's okay. We see that not only are there high rates of alcoholism when there's been adverse childhood experiences, but also high rates, even higher rates of picking a partner who's alcoholic. And we're not gonna shake this out in terms of gender, but frequently married to an alcoholic are women who've grown up with adverse childhood experiences, picking male partners who are alcoholic. Okay, adverse childhood experiences and depression. Depression, we know, is a leading cause of disability in developed countries. Here we see that the risk of depression increases for both men and women. So women are the lighter blue and men are the darker blue. And in a dose response fashion as the ACE scores go up. ACEs are held in the body, leading to mental, physical, and behavioral health problems in adulthood. Some of these problems are unintentionally handed to the next generation. Becoming an alcoholic, marrying an alcoholic, and suffering from depression are part of the integrated intergenerational transmission of adverse childhood experiences.
They don't.
So here are some examples of what we call ACE attributable problems in health. So quite a long list: alcoholism, chronic COPD, heart disease, depression, drug abuse, illicit drug use, fetal death, intimate partner violence, liver disease, mental health problems, obesity, sexual behavioral problems, smoking, unintended pregnancy, violence, and workplace problems are, by the results of this study, have all been determined to be dose responsive. The higher level of adverse childhood experiences, the higher level of these problems. So we're living in a time with stunning potential for shifting the trajectory of health and well-being for generations to come. If we can educate, a lot of doctors don't even know this. Okay, we are reaching at Pine Tree, and part of our training program is to reach out to substance abuse providers, medical providers, mental health providers, police officers. We're doing a systematic training across disciplines to help people understand, because you might go to the doctor with obesity as your main health issue, and the doctor may give you a diet to stay on or give you medication that might curb your appetite. But unless they try to deal with the stressors that result from adverse childhood experiences, they're just spinning their wheels, which is what Dr. Folletti was getting so frustrated with before he did this study. So we know that ACEs are common, that they're interrelated, and that they're powerful. And people with higher ACE scores are more likely to have multiple health and social problems, some of which increase odds of their higher ACE scores. But the discoveries about the effects of toxic stress on the developing brains provide biological plausibility for the ACE study findings. So this information makes a very strong case for concluding that the relationship between your ACE score and your health problem is cause and effect. Okay, now in research studies, they can't say that definitively, but the numbers are pretty powerful. So here, we're going to look at this just briefly. Here is a little pie thing where we're looking at different categories and looking at the risk in each of these categories for people with high ACE scores. So for instance, when there's a drinking and driving in the past 30 days, 45% of those people would be people with high ACE scores. Smokers, current smokers, 31%. Risk for HIV, 51%. Alcoholism, 65%. So this is just a nice little visual to show us, and it's sort of like the toxic sludge, right? It's like the sludge of adverse childhood experiences impacting so many areas of health and well-being in our community. And of course, like, even if we don't have these, if we're not if I'm not a smoker and I'm not maybe abusing alcohol, my life and the life of my community is still very deeply affected by the prevalence of these things in our culture. So we can look at this individually and think, yes, let me make sure I raise my children in a healthy environment, hopefully even healthier than my own was. But we also want to be thinking about the safety in our communities and how we can help others, especially if we have a service orientation, as many of us do. So we have the power to shift the dynamics that lead to high ACE scores. So the ACE study provides us with very straightforward information about the consequences of toxic stress during childhood. The scientific research gives us powerful information that we can use every day to improve health, safety, prosperity, and longevity. The other thing that we didn't mention is that people with high ACE scores tend to die 20 years earlier than the average American. So there's early death that results from unaddressed toxic stress. But the ACE study, it's not a detailed roadmap of services or programs. It's an invitation for us to be pioneers. This news is simply too important to wait for someone else to design a detailed roadmap. Through our collective knowledge and action, we're the ones with the power to shift the dynamics within our own families, within our communities, and with society that leads to too high ACE scores. So the ACE study invites our ideas and our innovations because the science is just way too powerful. So when we think about ways, what are core protective systems? So we know that every individual, regardless of their childhood experiences, has capacity and capabilities. So we want to zone in on helping them use the capacities and capabilities that they have in ways that are going to help them to adapt in healthier ways now. And big dynamic in the center there, attachment and belonging. So we know that the real antidote to stress is attachment. And of course, attachment in childhood and infancy sets the foundation for this. But when people have had, attachment injuries in childhood, it doesn't mean that they're never going to be attached later in life, that they can't develop healthier attachments, but it does involve services for them and understanding for them and helping them to form attachment bonds in their communities and in their intimate relationships. And there's some healing that's involved in that, but that's core to developing more protective systems and to helping people move forward. And then we have to be looking on a community level. How are we providing services to families where they're feeling part of a community? Right now, of course, during COVID, this is so lacking, and we're meeting today by Zoom. If it wasn't for COVID, maybe we'd be sitting in the library together. We know that families have been very isolated during this. We sadly know as clinicians, I'm a mental health clinician, that rates of child abuse are on the increase, rates of intimate partner violence are on the increase, because we are wired to be part of a community and we need that in order to be healthy. So what we do know about individuals who will do well despite adversity is that these three protective systems, like encouraging their capabilities, helping them to thrive in their attachments, and building stronger communities, is going to affect the rates of ACEs in our community in general, and start to provide more healing and protection for our culture. Relationships with caring and competent people are vital. Many people talk about the importance of people in their lives, people who recognize and encourage our unique talents, interests, and our strengths. Relationships with caring and competent people are vital contributors to resilience and recovery. So if trauma is about attachment injury and relationship injury, then healing is about connection with others. People who have difficulty with emotional regulation and like picking up on social cues, problems with addictions, etc., they can be challenging friends and they can be challenging neighbors, but relationships that provide security and belonging will become the norm as we learn to improve our skills and competencies to be relevant and helpful during times of stress and challenge, as well as during celebration and rest, both of those. So community, faith, and cultural processes, we foster thriving communities. This is where I think as people of faith, we have to ask how are our faith communities providing awareness and shelter for the people in our communities and for the people in our greater community, because we have a responsibility as people who, have faith connections and those connections that have made our lives stronger and more resilient, to share those with others. So I think we all can relate to this one, that this would be an important consideration for us as we think about ways that we can, as an entire community, help those around us. Like in particular in Elliott, like we have a population of about 6,000 in Elliott. And we know that there's a percentage of people in this community that are suffering greatly. And how can we be proponents for reaching out and, offering some sort of refuge for families and individuals who are struggling? That's our challenge. And the ACE interface looks at different ways of providing that. So through leadership expansion and coming together, sharing our learning as we're doing today. Today's an opportunity for us to learn a little bit more about ACEs and share ideas, to be results oriented as we move further, move on and in our examination of ACEs and what they mean and how they might relate to us individually and how they relate to our families and our culture. So when we help people understand this, we're lifting all beings. And I love this little picture here, you know, of people reaching out to others and helping. I'm just going to read the little thing that comes with this slide. Supporting healthy community processes that respect cultural traditions and values is a high leverage activity. Just as the rising tide lifts all boats, a high capacity community lifts all beings. People living in high capacity communities are less likely to have adverse childhood experience scores, high ones. There's less drug and alcohol abuse. There's less depression and serious and persistent mental illness, and fewer problems in school and work. So change is up to us. It's shaped by our thoughts, our conversations, the way we relate to one another in relationships, in families, and communities. So thank you. And that brings us to the end of this presentation. And I'm going to stop share and open it up to any questions that people have.
Okay, question. It's important to have a high capacity community. What are the, what is a high capacity community? What do they have that makes them so?
So there's a community out in Washington State. So this has been a national initiative, the ACE interface, which is providing ACE education throughout the country.
Mm-hmm.
And we're Pine Tree is at the forefront of doing this now in the Seacoast area.
Mm-hmm.
But there are communities out, like say in Washington State, they have, especially in the western part of Washington State, where they started doing this education 15 years ago. And they trained police officers, they trained schools, they trained guidance counselors. And so they now have in these high, functioning communities, much more understanding of these and an integrated approach so that if a kid gets in trouble, they don't just put them in a juvenile facility. They assess them, they work with the families. And in that sense, they are already providing comprehensive services. And the money that they have saved in Washington State by doing this is really impressive. I don't have the statistics right offhand, but communities that are more aware of ACEs and more integrated in the way they approach them have stronger communities and are spending. So even if we only look at this from a financial fiscal point of view, we would save our communities so much money if we didn't approach this as a pathological blame approach and lock people up and kick them out of school. We would be doing so much better financially because, it costs a lot of money to incarcerate a person.
Mm-hmm.
And we're not looking at the, we're not looking at the original impact of what their childhoods were like and helping them receive the services. We tend to blame and shame rather than name and claim. So naming and claiming trauma and understanding trauma will have tremendous impact. So, Pam, if you want, I can send you a link later to these communities in Washington State that have already integrated this more effectively and are having really good outcomes. And I do want to well, I won't bring it up, but you can go to the Pine Tree website, so the Pine Tree website shows that we have some podcasts on there if you want to, not too many yet, we're developing them. But there's more information about how we are approaching ACE education in the Seacoast area on the Pine Tree website. Did that answer your question, Pammy? Okay.
Because I'm thinking of, you think of helping the community, this would be wonderful. I'm thinking of how Elliott Connects can assist in this.
Yeah. I think all these things are coming together for us, and I do think I'd be very happy to present this again to the people involved with Elliott Connects, and, of course, originally when we had our first meetings, we had our police chief there and, Pine Tree is working on developing specific presentations for law enforcement. That's actually in the works right now. And I know that the Baha'i community in Elliott has a direct relationship with the police department in Elliott, and they're working on some similar approaches, but really there's so much that we have to weave together that I think we can do and will be doing.
Mhm. Okay.
Any other questions, comments?
Thank you. This has been really wonderful.
Yeah. So
I think
actually,
Carol wants to say something.
okay, go ahead, Carol.
Just wanted to say thank you, because it's each time I hear about this, it helps me understand more about it. And it's a very good presentation. Thanks.
Thank you. So actually, Laurel, after you stop recording, I would love to just ask people for feedback about presenting it again if they have any feedback. So, but thank you, everybody. I appreciate your being my audience, and
Thank you.
Thank you
Yeah.
so much, Kim. This is wonderful.
okay. Are you going to stop record?